I will begin with an overview of the different techniques of neurostimulation, neuromodulation. You have the oldest one, which is ECT. It's FDA approved, it's convulsive, 1938. You have TMS, of course, it's more recent. You have other techniques like VNS, vagus nerve stimulation, focal electrically administered seizure therapy, which is a sort of ECT. You have MST, magnetic seizure therapy, which is also some sort of combination of ECT and TMS, and you have other techniques that you know, tDCS, tACS, etc. You have more invasive techniques like deep brain stimulation, epidural cortical stimulation, random noise stimulation, transcranial focal ultrasound stimulation. So these are the main techniques that you will hear about, but we'll talk about ECT, TMS, and tDCS mostly tonight. So tDCS, we talk about this first. You have certainly already seen tDCS device. This is a Sooma tDCS with the cap on which electrodes are fixed. And the question is tDCS effective for major depressive disorder? And here you have a recent meta-analysis of 2020 on 1,000, a bit more than 1,000 patients with the active group, nearly 600, and sham group, nearly 500. 21 papers included in this study, unipolar, bipolar disorder, depression, and mostly resistant depression, but not only resistant depression. So the results, to summarize, is that you have a response. tDCS is effective for depression, but the effect is modest. You have 33% of response with tDCS and a bit less than 20% of remission, which is not a lot. But it's better than placebo. And the number needed to treat to have a response is 6 patients, and number needed to treat for a remission is nearly 11 patients. And if you compare it to ECT, we'll talk about that later, you need 3 patients to achieve a remission with ECT. So, but it may have certain use in the major depressive disorder. The other question is, okay, it may be better than placebo, but how does it compare to usual treatments and usual antidepressants? For instance, escitalopram. And here you have a study, a direct comparison, and you can see that on Hamilton Depression Rating Scale, over 10 weeks, the effectiveness of tDCS lies between placebo and escitalopram. It's in the middle. So it's better than placebo, but less effective than SSRI. So what I would say is tDCS could be offered for certain mild depression forms, or for patients who don't want medication, The treatment is not covered by insurances yet, but as the equipment, the tDCS stimulator is not very expensive, it may not be that difficult to offer that to patients, and even if they have to pay. When you compare it to escitalopram, it's interesting because it may not be a pharmacological approach, but you still have side effects, and you have even more side effects with tDCS than with escitalopram: itching, tingling, burning, headaches, etc. But you may find some patients who you could offer tDCS. That's for major depressive disorder. For other indications,